Hey guys, this is Anthony Calabro here. I'm just recording for my final project for CHPM2605 Practice Development and Survey of Personal Marketing. I'm going to start with the two binders that we're supposed to fill out and have for this recording. So my first binder here is my research binder. I'll go over the tabs in a minute. My second binder is my practice management. I'll go over that later on. For my tabs for the research binder, we have vertebral subluxation, wellness development, subluxation condition-based care, chiropractic spinal care, functional neurology, bad medicine, and new vitalistic systems. Just going to dive into the research that I found. So for vertebral subluxation, the first article that I found was health outcomes following cervical specific protocol on 300 patients with Meniere's followed over 6 years. This article had patients analyzed and upper cervical listings were determined to use Blair X-ray analysis. 90% of patients had PI atlas on the opposite side of the affected ear. When the patients were in pattern, they were adjusted using toggle recoil or Pierce results knife edge. For 6 weeks, the average rating of vertigo dropped from 8.5 to 3.0. For wellness development care, we had a research article with the topic of health promotion and prevention practices in chiropractic outpatient teaching clinic, a study to determine if patient file audits reflect active health and wellness advice. In this study, 100 patient files were randomly selected and scanned for instances of health promotion advice for at least one occasion. Of the patients that were obese, 73 received advice on diet or nutrition, 80 received advice on exercise, and only 8 patients received advice on health weight management. The study ultimately showed that there were needs to be improvement in the way wellness is developed in the future. For subluxation condition-based care, the study I found for this one, resolution of urinary incontinence following chiropractic biophysics protocol to the chiropractic biophysics protocol to reduce vertebral subluxations. This article was looking to reproduce the effectiveness of chiropractic and rehab on a patient with urinary incontinence and vertebral subluxation. I myself used chiropractic biophysics for 2 years before I came to Life University. It's a great technique. It's very effective, so I personally know how well it works. Next subject is chiropractic spinal care. A study I found for this, there's correction of cervical kyphosis and health concerns following a single adjustment utilizing the Pierce chiropractic technique. This article showed the procedures and results of reproducing immediate kyphosis using the Pierce result system for correction of vertebral subluxation following just one adjustment. The next subject is functional neurology and chiropractic. I found an article that's titled Resolution of Ataxia in a Pediatric Patient Undergoing Subluxation-Based Chiropractic Care. This was a case study, by the way. In this study, a 7-year-old female presented with ataxia stemming from transneuronal dysfunction to the right cerebellum. After only 4 visits, she received high-velocity, low-amplitude adjustments to those affected areas. Those 4 adjustments marked improvements of gait patterns and resolution of that ataxia completely. The next subject we got is bad medicine. The study I found for bad medicine was elevated heart rate in psychiatric patients and different effects of psychotropic medication. This study analyzed the different psychotropic effects taken through various patients. Results showed that the psychotropic medication increased resting heart rate. And for our last topic, it's new vitalistic systems. The last article I found was titled "A Positive Concept of Health Interviews with Patients and Practitioners in an Integrative Medicine Clinic." This study conducted different interviews with patients and healthcare practitioners to explore their understanding of health, that is, more the absence of disease. Okay, and that's just about it for my first binder. I'll move to practice management now. So for practice management, things that we're going to touch on, I'm going to go over what I would say. I unfortunately don't have a patient with me. I'll go over like the protocols of what I would do in my office one day, of a new patient coming in for the first time, and then a follow-up exam, second visit, such like that. So for practice management, the things that were supposed to be covered: the pre-visit form, the first visit form, healthcare classes, report of findings, and progressive exam. So that follow-up exam I was talking about. So for the office visit with your patient, your first office visit, you want to conduct an interview with that patient. So I'll just give you a little taste of what that'll be like. So a patient walks in. "Hey, how's it going? I'm Dr. Anthony Calabro. I'm very excited to get started today. You're one of my first patients. Just to start off, just wanted to see what's going on with you, why you're coming in for chiropractic care. Just wanted to see if you were a good candidate for the care that we provide." So let's say the patient states he has neck pain or headaches. Questions that could follow that: do you have any idea what's causing that pain? How did it start? When did it start? Is it consistent? Is it random? Have the patient describe that pain. Is it sharp, achy, dull? Does it radiate? Does anything make that pain feel better? Does anything that make that pain feel worse? Have the patient rate that pain between 1 and 10. Go on currently, average, and when it first started. And when I say 1 to 10, 1 being basically no pain at all, 10 being disabling where they can't really do anything. So yeah, that's basically the basis of a SOAP note, the subjective objective assessment plan that we go over in the office. From there, you just ask them if they're on any medications, which this all would be in the first pre-visit form that they would fill out before they even come into the office. So I'll continue the conversation. From what we've discussed and from what I see on your pre-visit form, I think you're a great candidate to receive our care. You then explain to the patient what we'll be doing on the first visit. We'll be doing a family history. We'll go through an x-ray process. I'm going to do this mainly to get a better look at what's going on inside your body, to find the more localized and specific problem with your spine. We'll tailor our techniques towards your condition to help you achieve a more optimal function as soon as possible. In just a few moments here, my CA will take you down to the x-ray room. We'll take some vital signs such as blood pressure, height, weight, BMI. We'll also do some balance-related proprioception tests. And when they're done, I'll come in for the x-rays and finish you up for the day. Before you go to the x-ray room, just wanted to let you know we will not be adjusting you today. The reason why is so it gives me a little bit more time, my team, to gather all the information from the exams we'll be doing. I'll give your x-rays a look, I'll analyze them, and I'll be able to approach your adjustment accordingly for your second visit. In terms of finances, we'll have our receptionist come in and talk about that. She'll give you some ballpark estimates as to what type of care you'll be under, what type of plan, and then we can start from there. But for today, you can go with my CA down the hall. I appreciate you coming in, and I'll see you in the X-ray room in a few minutes. And that's basically the first visit. So I come in for the second visit probably a day or two after. Here they come in. Hey, how you doing? Good. So after we looked at your reported findings, we decided that we can definitely start adjusting you today. So here are your reported findings. You show them the x-rays, stuff like that. Now that we've discussed your reported findings, I'll be happy to answer any of your questions. And most frequently, from what I've experienced in a chiropractic office, most patients will ask, how often do I come in, or should I come in? And then the chiropractor will explain. With most patients, I'd like them to come in about 2 times a week for about 6 weeks. After those 6 weeks, we'll reevaluate you and take more x-rays and vitals. And from those findings, we can most likely reduce your frequency of visits depending on how your spine is looking and how your overall health is progressing. As an official patient of our clinic, you'll be required to go to our monthly healthcare classes. At these classes, we'll cover various topics such as nutrition, exercise, and stuff like that that'll assist the healing process outside of your chiropractic care. It will require some work and commitment on your end, but our patients have had great results with sticking to these suggestions. For these classes, feel free to bring family or friends. We'll leave it open to anyone who's willing to come in and sit down for about a half hour and get some free health-based knowledge to help become healthier overall. Free food could be involved. We have these healthcare classes on Thursday nights at 6:30 every 2 weeks, and I'd love for you to come. And if you like us on Facebook or have already signed up for our weekly emails, I'll be sending out information on special events such as patient appreciation days, complimentary dinner with the docs, with you and other patients. These will be completely free and educational. You then ask the patient if they have any more questions at the time, and then you sort of conclude. Okay, well, I'm excited to get you on the table and start your care. And they leave. So say the patient's been coming in for 6 weeks, they're doing well. You're about to reevaluate them. They come in for this next visit. So you ask how they're doing. You have the patient rate their pain on a scale of 1 to 10 again. See if they've improved. Most likely they will. And then with the dialogue. We'll be doing another set of x-rays today and the same exams that we did during your first visit to see how far your spine has progressed. Other than that, we'll be giving you a brief survey after you're done today. We'd like for our patients to give us feedback on our staff and how chiropractic care has been, how it's helped them. This isn't just to benefit us as an office, this is to benefit you as well. Just to let us know on what you'd like to see more of or less of, what we can improve on, what we're doing wrong, stuff like that. And at the end of the survey, there'll be a little section at the bottom for referrals. If you can think of 1 or maybe 2 people, family, friends, anyone in your life that could benefit from our care, just jot down their name and number. This benefits us as an office to keep our costs low on marketing and to keep an inner circle within our office and so we can provide the best care possible to the community as a whole. The next time they come in, you ask how that name has been doing, give the patient a call, follow up, just do small things like that. So to conclude, after 6 weeks, you just thank the patient. Well, thank you very much for continuing your care with us. We appreciate you, and let's keep working towards maintaining that healthy lifestyle for you and your family. Thank you.